everyone. So this video, we're going to talk about clinical reasoning. Historically, what I usually do is host group office hours, which is why the slide says group office hours with Ms. Gonzalez. But this semester, it's going to be available as a recording, so that way you can return to it and review some of the concepts. So a little background, I started doing group office hours a few years ago in response to noticing that students that come to third semester tend, if they're going to struggle, they tend to struggle with a few particular things. One being the higher level thinking that is required in this course. So instead of just seeing you guys struggle the whole semester, what I started doing is just talking about it up front, giving you a heads up. Hey, this is clinical reasoning. This is the higher level thinking that you need to be able to do this semester. And here's some strategies of how to do it and how to approach the content when you're studying to be successful in this course. Okay, so what is clinical reasoning? Well, it's a really popular term right now that you'll hear, clinical reasoning and clinical judgment. But basically what it is how nurses approach patient care situations. So look at this picture right here. What do you see? What is happening? What is the priority? How would you handle this situation? What would you do first? What would be the expectation for a nurse? What would be the role that you would play in managing this situation? Clinical reasoning is an approach to patient care. So there's different pieces and different steps that we're going to talk about. And as we are going through the content for this course, we're actually going to teach you in a way that you would be able to approach these different complications we're going to talk about this semester, the different disease processes we're going to talk about this semester, in a way that a nurse would approach it. Okay, so first of all, here's a question for you. I want you to read this question and think about what your answer is. You can pause the video, but I'm going to do a little, like 20-second delay here. So a trauma patient arrives to the hospital. The nurse should prioritize care based on which abnormal assessment findings? Pulse oximetry, 88%, audible stridor, blood pressure, 74/45, or pale, clammy extremities. How do you approach something like this? The answer to this question is audible stridor. So if you notice, pretty much every single answer right there is some kind of complication. They're abnormal parameters. There's a lot going wrong with this patient here. But how do you prioritize? So one of the strategies that you can use this semester is to really rely on the ABCs. That's just one strategy. Sometimes there's other ways that we're going to teach you how to prioritize and how to approach the content. So that's just one strategy, is airway, breathing, circulation. So the reason I gave you guys this question is because this semester we're dealing with complex patients. We're dealing with patients with multiple complications. We're dealing with patients with advanced illness. And so when everything seems bad, and sometimes these patients have multiple issues happening, when we're testing you, when we're talking to you in class, you have to be able to tease that out. So you must prioritize. So these patients tend to have multiple issues, multiple things are going wrong at once. And when that is the case, then you need to be able to prioritize. So for that question, if you've got airway issues, oxygenation issues, circulation issues, and so on, then the best place to start is airway. So clinical reasoning. How do nurses approach patient care? Well, a nurse, let's see, 15, 20 years ago, decided to start to put together some of what was known about nurse thinking, nurse decision making, especially in particular with these complex patient situations, and designed what's called the clinical judgment model. So this is Tanner's clinical judgment model, and you will actually see this embedded within our course, this type of thinking, and it's embedded in nursing practice. So if you look at the dark gray boxes in particular, that's where we're coming from this semester. It's really important that you become familiar with this type of nurse thinking. So the first step is noticing. And you could think of it like an assessment, but how you notice and what you notice and what you're looking for in order to notice, that is really important. And it's a little bit more than just doing a head-to-toe assessment. The next piece is interpreting. So you want to study in a way that you understand what is happening with your patient. You understand the disease process. The pathophysiology of the disease process is really important this semester. If you can understand how the body is malfunctioning, the steps within this pathophysiology of this condition, it really helps you to interpret some of the abnormal assessment findings or understand why you're seeing some of the abnormal assessment findings that you're seeing. And it also helps you to prioritize between them. So if there is something that is more significant, if one assessment finding means something that's more significant or signals a greater complication, then of course you're going to prioritize that over an assessment finding that you interpret as maybe not as life-threatening. So that's where interpreting comes into play this semester. After you interpret properly, after you've noticed certain things that you need to notice and interpret it, then you move on to responding. So this is when you have to decide your best action. This is where sometimes it's tricky for students. There are definitely a good amount of questions that we like to ask you as far as what intervention would you do? What intervention would you prioritize? If you have not properly noticed and interpreted the information that is being presented to you, you will not respond correctly. And this is what throws some students off, because sometimes they narrow down to two choices for their test answers, and they're just not quite sure which one. But if you've done the noticing and interpreting correctly, then naturally the correct response flows from there, the correct intervention, the best intervention flows from there. And then finally, reflecting. So looking back on the situation, sometimes you have to evaluate, did the medication work? Did that treatment work effectively? What have you learned about the situation that you can apply for the future? So a lot of reflection this semester. And we're actually going to talk about each one of these pieces and some study strategies that will help you become really good at noticing, interpreting, responding, and reflecting. All right, so first, I actually have an awareness test for you guys to watch. So let me flip over to that screen. Here we go. So here's your first test for the semester.
This is an awareness test. How many passes does the team in white make?
Go!
The answer is 13. But did you see the moonwalking bear?
A lot of people miss that when I show this during live group office hours. Most students are like, oh my gosh, I did not see the moonwalking bear. So the point of this awareness test is it's easy to miss something you're not looking for. Now, granted, they did tell you to count the passes, right? Well, that's because, you know, because you were counting the passes, you missed some vital, well, not vital in this case, but you missed the moonwalking bear. So back to clinical reasoning and to what nurses do, if you go in with the wrong idea of what you should be looking for, then you're going to miss something that's really important or really vital. So that's what we want to help you tune into this semester. We're going to talk about what are those things that are important to notice and to look at for each of these disease processes. So that way, when you are practicing as a nurse, you're less likely to miss something that's really important. All right, let me get back to the slideshow. Okay, so what is part of good noticing? Well, you need to know what to look for. So besides a head-to-toe assessment, which you're just kind of assessing everything, what we really want you guys to get good at this semester is identifying your focused assessment. So oftentimes, if something is going to go wrong with your patient, it's in the focused assessment. Focused assessments can be a system assessment. For example, let's say that your patient has a heart attack and they come in. Well, your focus assessment for that patient is probably going to be cardiac, because that was the problem coming in. If there's going to be another complication, it's probably going to be within that cardiac system assessment. Beyond that, a focused assessment can also be related to a particular disease process. Later on, we're going to talk about strokes. One of the focus assessments that's done for a stroke patient is an NIH scale. They're looking for particular things, signs and symptoms of an evolving stroke, or CVA. So focus assessments is something that is really important for you to be able to identify, because it's going to help tailor and refine that information that you're looking for. As opposed to just looking for any and every abnormal assessment finding there is, it's going to help you narrow down what's most important. The second piece, defining characteristics of the disease complication. So when you are studying and when we're presenting information and we're discussing different disease processes together, we will always give you certain defining characteristics of that disease, and we'll talk about complications that could happen. Those pieces are really important for you to learn. For example, let's say a patient comes in and their pulse ox is 93%. They're not oxygenating well. Okay, that pulse ox being low can signify so many different problems. However, if we're talking about a pulmonary embolism and they came in with a DVT, perhaps they have a risk factor, maybe they had a particular type of chest pain, maybe they're going to have certain complications of a pulmonary embolism that are very specific to a pulmonary embolism. So maybe that 93% oxygenation doesn't really narrow that down for you, whether it's pulmonary embolism issue or whether it's pneumonia or whether it's acute respiratory distress disorder. But if you focus also on those defining assessment pieces that really help you pinpoint that complication or disease process, it's really going to help you learn this content better in a way that a nurse would. You don't need to be distracted with certain assessment findings that aren't as specific as others. So study in a way that you understand the defining characteristics of the disease and complications, and not just the assessment findings that would be common with all the different complications that can happen. Another thing to get good at with noticing is understand the difference between a stable versus an unstable patient. The reason why this is important is because sometimes the treatments differ whether your patient is stable versus unstable. For example, with dysrhythmias, if you have a patient that has bradycardia, you are going to manage them a little different if they're stable versus unstable. And so to make one, you got to make sure you understand, learn, how do you know that patient is stable versus unstable? And then second, you're going to want to learn how would you respond to the stable patient versus the unstable patient. All right, so let's consider a complication. Write down a few things. Talk to me. You can't talk to me, right? Because I'm not here anymore. But write down a few things that you know about patients on ventilators. What types of complications might they experience? So you can pause the video, or I'll do a few second delay here before moving on. Okay, so when you are at home studying, you, for example, would be studying complications for patients on a ventilator. You might be studying their focus assessment. You might be studying defining characteristics of these different complications. And you might have studied in a way that you understand stable versus unstable patients on a ventilator. So if you studied in this way, this kind of question should be pretty straightforward for you. So here's a question for you. And if you look through the question, think about what would be your focused assessment. Okay, start there. What's your focused assessment? The nurse assesses the patient on a ventilator. So what would be important for you to assess, right? Probably respiratory system. So the crackles in the upper lobes, that might be pretty significant, right? Okay. Now think about your complications that you identified before when you were thinking about your complications for patients on a ventilator. Are there any defining characteristics of these complications? And if so, do you see those defining characteristics in this question? So that would take you to temperature 100.8, white blood cells 14. Those are defining characteristics for what? Probably pneumonia, right? Temperature, we have infection, we have crackles in the upper lobes, lung lobes. So if you noticed those important assessment findings, and then you correctly interpreted that as, hey, I think we might have some kind of complication, maybe we have ventilator-associated pneumonia, that will lead you to what the real question is: what action should the nurse prioritize? Well, what goes along with managing pneumonia or ventilator-associated pneumonia? Would we want to recheck the temperature, collaborate with RT to adjust vent settings, request an order for chest x-ray, or administer at least 640 milligrams IV push? And the answer is request an order for chest x-ray. Generally this semester, when you are presented with a problem, we don't have to reassess. We have a problem, we need to manage the problem. Collaborate with RT to adjust the vent settings. Sometimes that is appropriate with certain complications, but not this one. Request an order for chest x-ray. Yeah, that makes sense because maybe we're suspecting pneumonia. We want to ask the doctor if we can pursue this line of thinking, get some treatments on board. D, administer Lasix, 40 milligrams IV push. That would more be associated with another complication, not particular to ventilators, but maybe somebody who has fluid volume overload, which you might hear crackles in the lungs for that as well. Maybe just in a different place. All right, here's another question. So go through those same steps. What would be your focus assessment? What would be some defining characteristics of the disease process or a complication associated with this? And then is there anything that's telling you patient is stable versus unstable? Okay, so if you're studying patients with chest tubes in the ways that we talked about, then you would know that there are certain assessment findings that are normal with patients with chest tubes. They're completely stable, they're doing good with their chest tube, versus a patient who maybe is experiencing a complication or is not doing as stable as, is not as stable as maybe they should be. So one of the complications you're going to learn about is excessive drainage, excessive bleeding. So when you get to this section in your lectures, you're going to see that sanguineous drainage over a certain amount is not something that's good, and it would be concerning the nurse. some of the other findings are normal with patients with a chest tube or are indicative of the reason why they even have the chest tube in the first place. Okay, so a study tip for you is the pyramid game. So you might not have played the pyramid game before, but I actually have a little clip to show you guys what the pyramid game is all about.
Geico's whole 15 minutes thing.
Oh, sorry
That
about
came
the
from me.
advertisement.
My first idea
Doesn't
was
look like I can
in
flip
one
through
quarter
it.
of an hour, your savings will tower. But that's not catchy. So I thought 15 minutes, 15% serendipity.
Geico.
Welcome back to the Tonight Show. I'm Steve Higgins, and we are playing the classic TV game show, Pyramid. On our first team, we have Questlove and Jimmy Fallon. They will be facing off against Super Bowl champion who hosts Fox NFL Sunday. It's Michael Strahan. And Michael's partner tonight stars in the new movie Gold in theaters next Friday. Please welcome Bryce Dallas Howard.
Good luck, good luck, good luck. Good luck. Good luck.
Fantastic. Be picking a category. Then you'll try to get your partner to guess as many words or phrases in that category as you can in 30 seconds.
Okay.
The team with the highest score after 4 rounds wins. Any questions?
Well,
Anybody?
I was wondering
Great.
if-
Here are the categories. Tonight we have textual healing, grin and bear it, vinyl exam, Oy. Slam poetry, ticket for one, and stay in your lane, girl. Jimmy, why don't you pick the first category?
Stay in your lane, girl.
Stay in your lane, girl.
Stay in your lane,
Lane
girl.
girl. These are things you see when you're driving. 30 seconds on the clock.
See how much we drive. Right, exactly.
You guys are 2 drivers. You like
All
Mary
right,
Andre?
stay in your lane, girl.
30 seconds.
Ready? Here we go. Okay, thumbs up. You want
Hitchhiker.
Yeah, it's not it's a red octagon.
Stop sign?
Yes. It's not a hotel, but it's a
Motel.
And you go to McDonald's, you go through the
Drive-thru.
If you go pay money to go over bridge.
Toll?
Yep. And if you the little white guys said
Stop sign? Yield?
no, you can
Caution?
if he blinks on the street, you're trying to
Traffic cop?
You have to walk through this part of the street with. Sorry.
What if I were to say
little white
crosswalk?
guys screwed you up? That was the thing.
Right, that's pretty funny. Let me escape this. Okay, so the goal of this game is really you're trying to get some trigger words to help jog your memory. So when you're studying, this is the only time I would recommend flashcards. On the one side, you can put, for example, a complication. And then on the other side, you can put some of the words that would be associated with that complication. So you can study 2 ways. You can have your flashcard and look at that complication and try to think about all the different important trigger words that might be on the back side of that card. And or you could actually do this with a friend. So an example here. Now, again, you're looking at this, and usually we do this together. But let's say you don't see signs and symptoms for congestive heart failure. So if I was in your study group and we were studying congestive heart failure, then I might give you certain words such as fluid volume overload, crackles in the lungs, lower extremity edema. So I would give you certain words that go along with it, and hopefully you would guess, oh, that's signs and symptoms for congestive heart failure. So you could do this also with the disease process and the complications and the different things that we talk about in class. And the reason for that is, again, when you're going to present it with a situation or question, the more times that you practice associating these words with these complications or remembering these assessment findings with these complications or this disease process, the easier it's going to be for you to pick them out when you're either assessing a patient in real life or when you're looking at a test question and trying to figure out what are those words that are most important to highlight. When you see those words on the test question, or when you're looking at a patient in real life, understanding what is important about that situation or that scenario, pulling that out really helps you with that next step that we talked about with interpreting. Okay, so again, you would not have the nursing management for client on a ventilator, but maybe I would give you information such as suctioning the ET tube, performing mouth care, listening to lung sounds. So hopefully those trigger words would help you get to nursing management for a client on a ventilator.